Welcome to the Pharmacy Frontiers podcast, a podcast dedicated to the pharmacy profession. Daniel Good and Tim Mitchell are your co-hosts today, and we're excited to bring you the latest from the frontiers of pharmacy practice. Let me remind our listeners that the Pharmacy Frontiers podcast is available for streaming on your favorite podcast streaming app, whether it be Apple, Podbean, Spotify, or YouTube. Be sure to bookmark and like our podcast to get notifications on the latest release. The comments and opinions shared today are those of our hosts, our guests, and not official statements of the Missouri Pharmacy Association, Mercy, nor Mitchell Pharmacy. Now let's introduce our guest.
Welcome to the Pharmacy Frontiers podcast, podcast dedicated to the professional pharmacy. And today we're excited to bring a market disruptor, Mark Cuban, to a Pharmacy Frontiers podcast. Welcome, Mark.
Thanks for having me on. And that was the professionalism of that intro was great. Like I've never seen somebody do that. You guys are like at Shark Tank levels.
Well, I'll have to give that props to my daughter. She created that for us. She works in our pharmacy. She's not a pharmacist, but she helps me do all the logistics and all the stuff that I do behind the scenes. And we very much
she's a keeper.
Her helping with the podcast. So
she's a keeper.
Yeah, absolutely.
Well, as you know, our small little podcast here really is focused on the pharmacy piece. So I don't know that you need a whole lot of introduction to our podcast listeners, but let's just drop right into it and tell us, what motivated you to become a disruptor? You've made a huge impact the last couple of years.
Yeah, I mean, I've just always been an entrepreneur, and I always tried to focus on industries where I thought I could make a difference and that I thought had a lot of inefficiencies. Whether it's, starting the first streaming company, the first HD company, the MBA, I always just like to raise hell. And when I got a cold email from Dr. Alex Washmayansky, who's now my co-founder, and we started going through all of it, it was obvious this was a messed up business. And, to me, that was an opportunity, and that's what got us started. And as you guys know better than anybody, the opacity and the information misalignments are the key to all the issues. And so when we started Cost Plus, just being completely transparent was really a key to everything.
Well, and welcome to our big mess. I mean,
right.
My wife actually, we say this regularly when I go home. She's like, man, I just don't understand what's going on in pharmacy. Why somebody else can price your medicines for you. That's crazy, so absolutely crazy. So
it's insane. And, if you want to start there, the craziest part is, if we were on Shark Tank and somebody came in and said, okay, we have a pharmaceutical company where we manufacture these brand drugs, and then we sell them to these big distributors that control 90% of the industry, and we sell it at retail price. And Kevin would be like, what? We're going to take you out behind the barn and shoot you. It's just, he'd unless he could get a royalty, of course.
Yeah.
But just right there is where it all starts. If a brand is selling to a wholesaler, literally at 90% market share, and that wholesaler is not able to negotiate a better price than a 1.5% prompt pay discount and 3.5% for data, so whack -5, the whole industry falls apart from there. And you guys take the biggest hit, because if there's like a $600 anticoagulant, that brand drug that we won't name, that means they're buying for $570. And if they're buying for $570, they can't sell for less, give or take, to you guys. Right. And if you guys can't buy for less than $570, an insured patient walks in, you can't sell for less than $570,
Right.
And then you've got somebody in their deductible phase, you can't sell for less than $570. And then on top of that, if they're insured and they're outside the deductible and they're paying their copay, you guys don't even know if you're going to get fully reimbursed, and you're not going to have your costs covered in terms of filling the script. And it all starts because those brands sell to wholesale at whack -5. So I went to several CEOs of big brands and I asked them, I'm like, why are you doing this? Because if your goal is to help as many patients as possible, selling at whack -5 when your net after rebate is about $300 or 50% on that $600 anticoagulant, if you worked everything from net, more people could afford it.
Absolutely.
More pharmacies could stay in business. And they're like, we'd love to, Mark, but the PBMs need their rebates. Their PBMs if we don't do it this way, we're going to get diminished on the formularies. And so, the other thing, we know the PBMs do this, but I hate blaming it on the PBMs. I want to blame it on the insurance companies because they're vertically integrated. One of the big mistakes I made getting in as I got into this and continue to learn is that I always looked at PBMs as standalone companies. They're not. They're not even close. They're part of these big conglomerates, or they own the big conglomerate. And culturally, the way they deal with patients, with sponsors, with pharmacies is the same way their insurance, parent companies deal with, hospitals and everybody else.
Right.
And pharmacies for that matter. And so culturally, I've started calling them, the conglomerates or the insurance conglomerates, because people have to start to understand, because we're seeing so much legislation geared towards PBMs, that because they're so vertically integrated, they'll play left pocket, right pocket. We'll just move from spread pricing on pharmacy to spread pricing on medical procedures or, fees or whatever it may be. And so it's just, like we said, like off the bat, it's a messed up industry. But, the more you educate people like this and like you guys are doing, the better opportunity we have to get employers to change how they do business.
I think that's exactly
what it is, right? Yeah. The insurance company has sold this book of business as this is the model. This is the only model we can do. And that's not the case, as you described, right? Go to the payer, explain to them what net pricing is, and work backwards instead of, it's maddening.
Yeah. I mean, when I tell people now, employers, because what is it? 67% of employees are covered by self-insured employers. Mm-hmm. They get to make all the decisions. Literally, when you guys get underpaid on brand reimbursement, that's part of their contract.
Right.
And I've sat in meetings with them and said, do you know you're putting your local pharmacy out of business or at risk of going out of business because of the deal you did with your PBM/insurance company? They have no idea.
It's so complicated that, those brokers come in. I will tell you, I had a conversation with a local construction company here in our town, and I was talking to them. We opened our Cost Plus pharmacy about 3 years ago. It's a small little, community pharmacy. By the way, I get calls for years all the time. People are calling me.
That's fine.
We just
That's okay. Take that business. We're good. I want you to be good.
We work. Anyhow, long story short, I called a meeting and I went into a boardroom with the execs of this construction company. And I knew these guys. I mean, they get prescriptions here. I've known them all my life. And I'm like, who's this person? And they're like, oh, that's our broker. And I said, well, I don't need your broker here. And she's like, well, I'm here to make sure they don't make or hear something that may. And I'm like, I know why you're here, to make sure they don't understand what I'm trying to tell them about cost plus drugs and how we're able to provide a medication at much less cost, and why drugs are so expensive these days. And, I walked out of the meeting shaking my head. It was my son and I, but, so, I mean, I love the information that you bring to the public and all the different, ways that you've been doing it about PBMs. Absolutely crazy. And so let's go back a little bit. So you started Cost Plus. When did you start that?
We started shipping in January of 2022.
Okay. And so kind of tell us a little bit about, I know a lot of people probably know your story, but just a brief little, what
it was really simple. I mean, and you talk about brokers, right? So when we started, we had 111 drugs, generics. And I went and looked at my MAVs claims, which I had to fight to get, as you guys know. So finally got my MAVs claims and went through and just pulled out of the 111 drugs we had, only the generics that cost $30 or more with the MAVs. And we had spent over the previous 18 months, $169,000, I think it was. And then I priced them through our pricing at Cost Plus, and it would have cost me $19,000.
Yeah.
And I'm like, this is the same broker I had used in my businesses for years. And I'm like, obviously he's not my broker. Obviously he's not my friend. I thought he was my guy, right? Because they give you the normal spiel. Yeah, everybody else is getting an increase of 8%. We're only increasing you 5%. And it's just garbage. It's all nonsense. And once that settled in, it was like, okay, we're on to something here. Right. And then, especially generics in particular, we were immediately saving people hundreds of dollars per month because, as you know, imatinib, et cetera, you just walk into one of the big pharmacy chains, and if you don't have insurance or, high deductible, whatever it is, you're in your deductible phase, they're charging you hundreds of dollars, if not thousands of dollars.
Oh yeah, definitely.
So, all of a sudden we started getting letters and emails. People were walking up to me on the street. It wasn't about the Mavs, good or bad. It was like, oh my God, you saved my family, my mother, my father, my grandmother, my grandfather, X number of hundreds of dollars or thousands of dollars per month. I can't tell you how important it was. And then from there, our volume started to grow. And here we are 4+ years later, and we have thousands of SKUs and, have helped millions of patients.
Absolutely. So going back real quick. So, I'm a community pharmacist. There's community pharmacists all over this nation. Many of them will listen to this podcast. What advice would you give them to try to have that conversation with a local employer about what service? I know you're a supporter of community pharmacy. I know you are. I've heard you say that many times. That being said, what kind of advice would you give them to go out and be proactive about this?
So the first thing I would tell you is go to teamcubancard.com and sign up and add your community pharmacy, because we pay $12 per fill. We're not always going to be the cheapest, but where we'll send you at least a little bit of business is for anything cold chain. It's cheaper for us to send it to you than for us to try to ship with cold chain shipping, right?
Yeah.
And so there's a bunch of things, and then and we can talk about generic compliance ratios, but we also have cost plus marketplace where you can buy from us for that 8, 10, 12%, whatever your delta is. And particularly on the biosimilars, where we have Stargemza, which is Celero biosimilar for $365, et cetera. So, there's a lot of ways, and we talked to a lot of community pharmacists and made sure we were paying you $12 per fill to make sure that you're coming out ahead of the whole game. But beyond that, in terms of what you can do, it's just, when you said you went and talked to a local construction company, that's it in a nutshell. Right. Going out there and being proactive and really not waiting for people to show up on your door, but, going ahead and calling on them, particularly since you get to see the plans that people come in with. So the employees of that construction company, their plans, what their copay, when you can charge less for your copay, less for the drug than their copay, or even worse for coinsurance on specialty or other generics, right? Absolutely. And so I would tell them, do what's best for the customer. You might have a PBM come after you, but if you're cost plus, they're coming after you anyways, right? Right. You're already dealing with that on a day-to-day basis. So I literally would make a point to say to, that member and to the HR person or the CEO, look, you were probably, for this drug, this statin that's $5, right? From me, you're probably paying $15 to your insurance company, or to the PBM rather. Right. And so, and in total, between the member copay and what you're paying, you're probably paying 3 or 4 times what you should be paying. Absolutely. Why don't you just let them come to me? And if you're self-insured, next contract you do, make sure that any cash pay or out of pocket for members is applied to deductibles, because you're allowed to do that. And if you haven't been told that, let me talk to your broker.
That's right. Well, so the broker, like I said, she was in that meeting, just to go back to that. And she hung around, and I'm like, I just need you to leave now. And she's like, no, I'm going to hang around. And of course she was a young, cute broker, and I'm sure they sent her in. That being said, I had a conversation with the guys and the owner of the at my pharmacy. And I talked to him still regularly today. And I asked him, have you saved any money? And he's like, no, my costs keep going up every year. Well, no kidding, because you didn't make any changes. So the broker certainly kept it in her pocket. So
and you know what? At that point, the brokers are going to be brokers and try to get their commissions, right?
Sure.
There's no doubt.
That's their job.
And so there's going to be at least somebody in town who's a good broker, right? That really cares. And I would get to know those people. because I would say in your plan, make it so cash pays apply against the deductible, and send them to us as cost plus, meaning your cost plus locally, and you'll save money and you'll get more business.
Right. Absolutely.
Right. So I would leverage your strengths, and I say that to any community pharmacy, leverage your strengths to partner with brokers, because they're competing to get that price lower as well.
Right.
So they'll still get the commissions from the PBM, but that's mostly on brand stuff, which you're not cost plus on anyways.
Right.
Yeah. You're ended up, if you're getting it at a WAC -3, probably, maybe some stuff WAC -5 if you're lucky.
Right.
As cash pay, there's not a lot of that business.
No, there's definitely not a lot of business in that area. So why does transparency matter? I mean, we're dealing with a lot of complicated things with these employers. Why is it important to be transparent? Why do we want to do that?
Because the brokers, some of the bad brokers or consultants are going to be bad brokers and consultants.
Right.
And they're not going to tell them the truth about what's going on. And the one thing that transparency changes is that employer or that member or that individual without insurance or a high deductible can just look at the price,
right,
and see what their options are. And, being able to look at our price list, or, look up on ours or go to yours. And I'm sure, if somebody comes in, you're probably matching the price if you can, or coming as close as you can,
sure,
and saving them time and shipping. And so everybody wins. If they come to us, great. If they come to you, even better. I want to see you guys survive and succeed. And transparency enables the member/patient to make the best choices. There's absolutely no downside to transparency.
I agree.
It opens up competition, right? It's a free market.
Yeah, I mean, I wouldn't call it a free market because of those big insurance companies, but at least we can do our best to make it as efficient as possible.
So what should our pharmacists be doing then? What's the message we can send our independent owners that they can help with this to make this happen?
You got to be salesy. You got to be a salesperson. And you got to understand all the people who you can benefit, and other people whose interest, and other companies whose interests are aligned with yours. So for instance, we created this site, Cost Plus Wellness, where we started posting contracts for direct contracting between providers and employers. If there's a hospital that doesn't have their own pharmacy, or maybe even if they do, that is willing to do direct contracts, you can become part of those direct contracts, and be the pharmacy to pick up, through your PSAO or through, affiliations you have. You can work with other pharmacies if the company's a little bit bigger. You've got, just like you did with that construction company, that's the exact right way to do it. You have to realize you can't just wait for people to walk in the door.
Right. Yeah. They'll walk in and walk right back out. I mean, it's not going to be any different. So
yeah. And plus, the biggest value you guys have is that last 5 feet, because that's so critical to so many patients. Right. And you develop relationships with those people that are built over the years, and you want to continue those. And I know sometimes, they'll come in and they'll want a brand, and, from that plan, you're going to get ripped off. But if you explain that to them, right, and tell them, here's, the impact on me, I'd love to keep your business. Here's the cash option. Let's see if it's lower than your copay. Let's see if it's, lower than your coinsurance, particularly if they have coinsurance, right? And particularly if they're in their deductible phase. And, for community pharmacies that are in Texas and Tennessee and Indiana, and I think there's 8 states where you can apply a cash pay against your deductible by sending all the information to the insurance company. And so knowing, if you're in a state that allows that, and being willing to help them do that, is more business and more relationship building for you guys.
So how do you feel about the legislation that's going out, like say in Arkansas, Tennessee just recently passed the vertical integration laws? Do you feel like we're making progress when we do that? Or do you feel like,
there's some progress?
Are they going to shift it or what?
Yeah, there's no downside. Let's put it that way.
Okay.
I mean, I guess there's some, there are some PBMs that are not retail facing that, work with Medicaid and Medicare plans, and, where that might hurt them some, but I think you can figure it out. They can partner with you guys, right?
Absolutely.
To figure it out. And so if you guys, I think as these things happen, you need to go to the PBMs, the Centerwells, the Health Dines, the True Pills that aren't customer facing per se, right? They're not taking scripts, but they're filling, and say, look, if you can't have a pharmacy in my town anymore, I'll work with you. Just forward those scripts to me, or, you send them to me and I'll deliver them for you. Right.
Sure.
Let's just work out. You just pay me something, and you don't have to close. You're set, right? You can work with your, you can, even though you're not allowed to own a pharmacy, and you were, a wholesale type pharmacy, a non-retail pharmacy, let's work out something together. And you're all part of PSAOs, right? You're all part of different associations.
Right.
Have them go and talk to the True Pills, the Health Dines, the Centerwells, et cetera, that, can work with you to do that.
Absolutely. Yeah. The PBMs that are more friendly to community pharmacies definitely make a difference. That's for sure. So.
And I think he brings up a good point about those independents, that if we don't send business that direction, we're going to create those pharmacy deserts out there, right? And especially in the rural Midwest that we're at, in Kansas and Missouri and Iowa, and even parts of Texas, right, where those independents are going out of business. We have to provide that healthcare provider in those local counties. Otherwise, they have no one to go to.
Right. And those 5 feet between the pharmacist and the patient are probably the most important of all of pharmacy, or, all of the pharmaceutical industry, because that's where all the magic happens in terms of relationships and help. And look, we have a lot of customers. They'll come to us for price. They'll come to us for their tadalafil and their statins and, even their Star Gems up, because it's pretty straightforward. Right. But anything complicated, they're coming to you. And that's a good thing. And I think you guys should be supported, but you need to start developing those relationships with people who control the buying decision. And I don't think the industry or the associations do a good job there.
I agree.
The PSAOs are great with software. Sometimes they'll get you decent pricing on certain things. They still can't seem to fight the GCRs enough, but, which is a whole nother topic we can talk about. But at the same time, you've got to go out there and look and talk to the brokers and talk to those pharmacies who aren't going to be able to be open. Even if you go to CVS and say, okay, you're going to close all these pharmacies, make me a deal. I'll take it over, make me, work with me and I'll help fill so you don't lose access to your patients.
Yeah, absolutely.
And clearly I'm sorry, go ahead, Ted.
No, go ahead. I
was going to say, clearly, right, the automation of medication distribution is really going to take over the majority of that physical distribution process, whereas a pharmacist then can really be engaged in more of a clinical tone with those patients. And so I don't know if you've gotten into that or see where the pharmacists as providers, if that's something within your bailiwick or not. Do you have an opinion?
Yeah, look, we see the technology. You're not counting pills the way you used to. And you're gonna count pills less and less and less. And the bad part is the complexity the insurance companies / PBMs introduced to all of it, and then all the vertical integrations through the switches and hubs and all the hassles they create there. And then, like I said off the bat, the pricing that puts you guys at a disadvantage from the minute one. What I would push for let's take it in a different direction. How can you guys do, through your PSAOs, do direct contract is not the right word, but do be a GPO on your own for brands? Right? Why can't you guys be an MSR or an Ascent? And in aggregate for the walk-in business, even if it's just uninsured business, being able to take a cash claim for a brand and then get reimbursed on the rebate. Now you still got the cash flow issue, and you'd have to work through that, right? Because if you're offering a net price to a patient and you're not getting your rebate for 60 days on a $1,000 drug, that can be a lot, or on a specialty drug, that could be a lot.
Yeah.
But at the same time, you could start to work through those things. Right. If you were able to get the rebate. Look what happened with GLP-1s when you're not inventorying anything because not getting reimbursed enough, you're losing $100. You're
Right.
definitely, if somebody wants to walk in and buy, at the net price that they're offering on direct to patient, you don't even have access to that.
Right.
There's nobody selling to you at that price. And I think that's where you guys as a community, as an association, need to stand up and say, look, like I've talked to IPC and they're trying to do a GPO, and there's other PSAOs trying to do a GPO, but they're not getting enough access to brands.
Right.
And I would call the Lillies of the world, and I would call the Novos and the BMSs, et cetera, through your association, and say, look, we get cash business that can't afford your drug because of the way things are structured.
Right.
Why can't we have a GPR? Why don't we get access to rebates? And by the way, I know you're afraid of double dipping, because once it gets to the hub, somebody's going to steal it and try to get the rebate. Well, we'll send you all of our claim. We'll send you all of our invoices, rather. It's not even a claim, right?
Gotcha.
We'll send you all of our invoices in real time. We'll just email them to you every time we sell, a GLP-1, every time we sell an anticoagulant at $350 and we make $20, as opposed to trying to sell it at $600 and not having it in stock, and then, ordering it, and then, et cetera, et cetera.
Yeah.
It's just, it gets really convoluted the way it's currently set up, and patients are the ones that suffer.
Absolutely.
I would try to get as organized as you can and raise hell with the brand manufacturers and specialty and say, look, if you just get us rebates so we can sell at net prices, we'll get a lot more customers for you. And the patients it's going to be a lot more affordable, and good things can happen. Now, of course, the PBM / insurance companies are going to fight that, but just like this legislation, 3 years ago, no one thought any of this legislation could ever possibly pass. Right. If you guys start beating the drums now we need net prices through distribution, we need to be, if not net prices, we need to be able to get rebates on cash sales, and we'll give you the information so there's no double dipping ever.
Right.
Then you start building that momentum, and hopefully it gets to that point. And we'll help you, because we face the same thing. Like when I talk to these big brands, I'm like, why won't you let us do a GPO and get rebates back? And it's the same thing they say about distribution, because the PBM said, if you sell to cost plus drugs, they're going to publish our price. Everybody's going to know the net price, and we're going to diminish you on our formularies.
Know how much we're going to get on our rebates. So I want to switch topics just a little bit. And I'd like to ask you about Trump RX. I don't know how, and I know that was rolled out at the beginning of the year. I think I just noticed your cost plus pharmacies on there now. Tell me a little bit about your thoughts on that.
Yeah, it's really simple. I mean, anything that creates the opportunity for patients to get medications cheaper, we're a fan of. Like I said, if it's going through your pharmacy, Tim, whatever, it's a win. And there are millions of people who are going to Trump RX that might not know who costplusdrugs.com is. And I'm all for it. We didn't pay to be there. There was no financial deal. It's just, they're a portal that links to us, and actually it's a great service, because where else can you really do price comparisons?
Right. Yeah, no, I love it. And I will tell you that initially I was a little on guard about, it's going to be a good RX type platform or something, but I do feel like there's some legit that you're in there. I think I saw Amazon's in there. And I don't even know if my store's listed. I probably need to check into that. But that being said, I need to tell you, we've had people be able to get access to GLP-1s again.
Yes. And IVF and IVF drugs.
Yeah. So it's been really positive, because we've been able to, we're not like publicly out there saying this is the best thing since sliced bread, because we're being cautious. But when a patient comes in, we see that niche, we're like, okay, I think this might work for you. And
go to Trump RX for that IVF, because it's been so expensive, or the 149 GLP-1, right?
Yeah.
Like, that's what people are like, gave you a hard time when you're standing up next to the president. Look, my politics don't matter if we're helping people save on their medications. And I'll tell you guys a quick story while being there, right?
Sure.
So we had to go through a walkthrough during the presentation, because, they went, if you saw the video, the the guy showed all the different pharmacies you could choose from and all that, right?
Yeah.
And it said for a statin, I think it was like $8.47. Well, when we got there and went through the first walkthrough, those prices at the local pharmacies were set for $2.47. And I was like, you can't do that. You cannot do that. You are going to crush anybody who's listed that's a local pharmacy.
Absolutely.
You know, that's good RX 101. And I don't like to talk badly about anybody, but you know, you can't. And then they said to me, well, and the good RX people were there. They're like, they did a survey of independent pharmacies and there wasn't a lot of joy towards good RX. And
no, there isn't. I can tell you that right now.
Right. And so I'm like, look, you know, in one case, they try to take money from the pharmacies. In this particular case, if you're trying to drive business that they can afford to fulfill, you've got to price it so they can afford to fulfill it, you know? And so I forget what they were using as their list of pharmacies and the pricing, but they use GoodRx pricing without the GoodRx hickey, right? So they can send it to you and you guys could just use your own card or just do the cash pay that you want to cash pay. But initially the pricing was set to be, you know, so that there was no chance anybody could ever make any money. And I'm like, you can't do this. And I went and talked to them and gave them a hard time and told them why you don't want to have a press event like this. And the immediate reaction from pharmacies, you know, thousands of pharmacies around the country is that this sucks, right? And you didn't think about it.
A huge rebellion. Yeah.
Yes. And they changed it to their credit. And I'll say this, put aside the politics again, the people at CMS that do the actual work, there are people there that are lifers. You know, they have been through multiple administrations. They just want to do the right thing. Sure. The people that did the IT, that made these changes, right, and changed the price, they just want to do the right thing. And they've been really responsive and understanding, you know, and they literally checked to see how independent pharmacies thought about those cards, right? And so I give them a lot of credit from that end. They have been super responsive, you know, Chris Klomp, Abe Sutton, Greg, some people, Tom, Greg, I forget their last names, but I try to call them out and give them their props because it's not just about it's not about politics to them at all. Right. And so the more you guys can speak to them, and we talk to them every day, the better, because we want to get more drugs added. We want to get the biosimilars added. We want to get the higher end specialty generics. We want to be able to convince the brands that, hey, you know, if you are able, and I've said this to them, if branding was priced at net through distribution, then all of those high-end specialty and brand medications that are, you know, priced at whack for their deductible phase or the uninsured, all those people are going to go through Trump RX.
Right.
If the pharmacy can buy it at a legit price or get the rebates. Absolutely. And so they're starting to understand that, and I'll keep pushing it. But anything you can get the associations to do to further educate them and people, that it would be a good thing, but it only works if the pharmacies are able to buy at net plus.
Absolutely.
Right.
Yeah.
You know, so, and by the way, the pharmaceutical brand manufacturers would make more money.
Yeah, they would. Yeah, because they pay more in rebates than they do in
rebates and fees, right? And the type of fees they charge. Like, okay, so I'm talking about these vertically integrated companies. And, sorry. And you can tell I get fired up about some of these things.
I know, I can tell. I'm getting ready to ask you another question.
So I was reading on LinkedIn, somebody pointed out that that one of the big three, I won't name them, has an advertising agency where they aggregate information about patients and they anonymize it enough for it to be legal, but they aggregate it and then they'll go back to the pharmaceutical manufacturers and sell to them. And you know how they sell to the manufacturers, right? You will buy this. And I had no idea, I knew about the fees. I knew about the adherence pricing and all that kind of stuff. Had no idea they were selling them advertising as well.
It's crazy.
Yeah,
so
it's crazy.
Yeah. Daniel, do you want to ask him your question that we were talking about before he came on?
You were talking about being in the White House for the unveiling, and you've talked to all the CMS folks. So you've got that taste of the federal government piece. Is there more in that for you? Do you see yourself having a greater role either as a consultant or an appointee or even an elected
Like
office?
I try to be a good human and a good citizen, right?
We're not going to call you President Cuban anytime soon.
No chance. No chance. Yeah, if you only knew what my children had to say about that. So, in any event, I'm there to help. I tried to help under Biden. I tried to help under Trump 1. I tried to help, under Obama, and I'll try to help under Trump 2. I don't care. When it's all said and done, the mission is the mission. The goal is the goal. You want your patients to be as healthy as possible. You want to be able to, stay in business, make some money, and make it affordable for every patient you possibly can. That's why we're in this business. That's why I'm in this business. I don't need to make more money. I want to change the way the game is played. And working with them, I'm happy to do it.
I love it. I love it. And so another follow-up question to that is, where do you get a bigger thrill at doing what you just talked about or winning an NBA title?
Winning an NBA title. You see the trophy back there?
Yeah. I know. I'm sitting here looking at all that stuff.
Why is it buried? It needs to be a little bit more prominent there, Mark.
Well, it's right next to my Shark Tank Emmy. Where's that? That's over there too. Humble brag, right? Humble brag.
You mentioned your kids. They're getting their college, right? So they must be getting ready to join you in the business, I assume.
16, 19, and 22. And they certainly do not want to work for their dad.
I have two of mine. My son Tanner, my daughter Taylor, that we were talking about earlier, work for us here in the pharmacy. My youngest son, Talon, decided he wanted to not go into pharmacy after he saw all the headaches that dad was having. But now he's decided he wants to go to medical school. And I'm like, you're going to have bigger headaches, buddy.
That's okay. We need more doctors. That's a good thing.
We do.
And my oldest know exactly who to write the scripts to, right?
Yeah. That's right. My oldest son is a pastor, so he's praying for all of us. So
How many kids do you have?
I have 5 children. My wife and I had 3 biologically, and we adopted 2 from Ghana, Africa.
Oh, good for you. Good for you.
Yeah. So we're getting them all grown up. The youngest 2 are 23 now, so we're super happy. Yeah, super happy.
Flies by, doesn't it?
Yeah, absolutely. So
I only have 2 kids. I have one in med school at UMKC, big basketball fan, and the other is a pharmacist that actually I'm going to send to Texas to maybe go work with you. She just finished up her residency, as a matter of fact.
Oh, good for her. Congrats on both.
There you go.
So you guys are doing something right. My kids are pretty good, though. I'm not going to say anything bad about them. They're good kids.
Yeah, no, absolutely. So I do want to throw one other thing. We were talking about PBM legislation earlier. Missouri, unfortunately, wasn't able to get anything passed again because of our opposition, PCMA, and all the opposition, pushing, these false agendas and trying to change things. I need to get you to come to Jefferson City to help us testify on why it's important to get PBM legislation passed. Would you be willing to do that for me?
If I can, at least by video.
Putting you on the spot.
Right? I have been talking to Josh Hawley.
Oh, I love Josh.
And I know they don't do a lot in senators, but he's all about it right now. Yeah. And at some point, I'm sure he'd want to hear more because what's good for Missourians is good for him.
Absolutely.
So, and we've talked a little bit about the PBM legislation, and he's part of the Break Up Big Medicine, and he and Warren just proposed something new. And if Josh Hawley and Elizabeth Warren are willing to work together, it's important.
It's got to be bipartisan.
Yep, agreed.
Yeah. Tim, you were just in D.C. last month. I was just there last month too in Hawley's office, and very impressed with what he's trying to get done. It's a difficult environment to work in, but at least he's going the right direction.
Yep, he's definitely going in the right direction.
I will tell you, the legislators, when I first started going to Jefferson City and to Washington, D.C., a lot of them didn't even know what a PBM was.
No, they had no idea.
So now I think we've made progress. I think we've educated them thanks to people like you, Mark, and us just doing all the things that we're doing, banging on their doors, and they're like, okay, well, you're going to hear to talk about PBMs. That being said, I appreciate, all that you're doing to raise the awareness and bring it to a head for sure. Well, we're going to wind some things down. We usually have a question that we ask all of our guests. that's something unique about them that maybe not everybody knows. I know you're a pretty well-known fella, but maybe not everybody knows about Mark Cuban that you'd like to share. For are you so much out there that there's nothing?
No, there's always stuff, right? Like, my kids are just like anybody else's kids. They think I'm an idiot still.
Yeah.
Okay, I'll tell you the one thing. So in case you're ever around me, I can't stand when people eat with their mouth open. That drives me crazier than anything. I'd rather sit in a room full of PBMs than sit eating with their mouth open. That is just my pet peeve. It's been that way since I've been little. I am like, ugh. Like my very, very best friend from college, he always eats with his mouth open, and he knows I won't go out to dinner with him. You want to have drinks, Ben? Yes. Dinner? No.
Well, you mentioned your college, Indiana, pretty good run this last year.
Yeah, Hoosiers.
Oh my God.
Hoosiers for sure. Hopefully we can do it again, but that was magical. Absolutely.
And you picked up a pretty good quarterback. Did you have anything to do with that?
I mean, I just write the checks. They do the rest.
Wait, it's a TCU guy's going to go to Indiana now, right?
Josh Hoover, yeah.
Yeah, your back door right there. Yeah, good deal.
Well, Daniel, you want to close this out here?
Let's give Mark the final word here. Mark, give us a final word about the disruptor and what life looks like going forward. And then we'll run it out.
Hey, you guys are doing great. Thank you for having me. I'll continue to do what I can, but really it comes down to, can you guys take it to the next level? And I think what's missing for community and pharmacy across the board, the independents, is you've got great association people, but individual pharmacies don't sell enough. Right. They wait for people to walk in the door, front of house, back of house, right? And they don't, just like you did, Tim, going out there and calling on accounts is critical. Absolutely. Because you've got to, in small towns in particular, where the biggest employer has 500 people at most, right? They're not getting educated. They're certainly not, spending time reading about PBMs and their insurance companies, and they're just listening to those brokers who probably aren't giving them the best advice. Yeah. And so the more you get out there and communicate and educate, and even if it's just like having a seminar, here's how you can save money, or finding out who the one or two self-insured employers are, and just saying, hey, can you just do one thing for me? One thing. Go to your PBM and say, you want to be able to apply all cash pays to deductibles. And I will save you money in doing that. And the insurance company shouldn't mind, because if, they're not having to pay out of pocket for the actual drug, you would think they wouldn't mind. Now, of course, the PBM charges a spread to that employer. Yeah. And, so you'll save the employer money as well. But if you guys go out there and get those self-insured employers to push for their cash buys going against deductibles, and explaining to him how that makes spread pricing goes away and is cheaper for your employees and their families, I think that's the low-hanging fruit. Because, as much as this industry is messed up, it's been the easiest to disrupt of any industry I've ever tried to disrupt. Because usually when, you're using technology and you're disrupting, you're saying, okay, it's going to be better here, it's going to be better there, but it's going to be more expensive. That's not what's happening here. You're saying your employees are going to be healthier, their families are going to be healthier, they're going to be happier, and we're going to save you money. And all that money we save in your benefits plans goes right to your bottom line. That's money in the bank. And if you happen to have a public company, you can look at their market cap and say, well, your price earnings ratio is 20. And so if I save you $1,000, you added $20,000 to your market cap, or $100,000, you added $2 million to your market cap. And so CEOs will understand that, but pharmacies have got to go out there and be a lot more aggressive. And I know it's hard, right? When you can barely see when you're done at the end of the day, and you still have to do inventory, and you still have to place your orders, and you still have to check this, and you have to check your cash account and make sure what came in, because you're freaked out. Because if this one doesn't come in, then you got to go to the bank, and you're already close to your limit, and you don't.
You're right. You're right. I'm living it every day.
Every day, right? Look, I've started enough companies. It's not even pharmacies that are like that. Yeah. Every business is like that. Yeah. And so I get it that it's hard to find the time, but it's one of those things where you've got to find the time to go to, the local business organizations, whatever they may be, the Chamber of Commerce, whatever it may be, and go talk to the biggest companies. And that's scary. It's hard to be the local pharmacy guy, and all of a sudden you're talking to the wealthiest guy in town. But then there you just say, look, Mark Cuban and I had a conversation.
There you go.
And I'm going to tell you I'm going to save you money.
Yeah.
And it's going to be easier, and you're going to make your employees happier. All I need is an hour. Well, our HR people are pretty good. They know what they're doing. And our broker, I'm like, and then what you need to have is just 10 bullet items.
Right.
And you need to have estimates of their claims, because you guys have a good feel. There probably a bunch of them are coming into you.
Right.
And, that makes me think. One of the tasks for the intern, the daughter, right, for you is for you guys to confidentially keep track of claims by business. I had not ever thought of that before. But if there's a local construction company and the 30 people that come in that work for that company, and one of them's on a specialty generic, and you cringe every time they have to pay co-insurance, that's the opportunity.
Absolutely.
You track that stuff, because they probably can't even get access to their claims.
Right.
And
no,
so
they can't. I even asked them that. Yeah.
Right. Yeah. So you coming in and just saying, look, I know you have these 30 people that you cover via insurance, right? They're members or their family members, whatever it may be. And here are 10 scenarios every single month. Right. And by the way, I know your deductibles are $2,500 or $5,000 or whatever it may be. So you've got these people that all the time can't even afford their medications during their deductible phase.
Right.
And it's a generic, right? Let me, and they're charging whack price of $200, and I can sell it to you for $21.
Right.
Yeah.
It's a no-brainer.
You guys track that.
No-brainer.
And maybe in your software, you get the PSAO to say, okay, create a claims report by company, by plan, right? So that you can then go back in and take it to them. Because literally you already know how easy is it for those companies to get their claims.
The companies, it's very difficult for them to get it.
Yes. Yeah. But who has those claims if they're coming to you?
The PSAOs and
the PSAOs and you.
And absolutely. We actually, our PSAO does give us access to our claims already. It's broken down by company. So
So imagine, have you ever taken that to a company and said, look,
no, and you bring up a good point. And I'm sorry, we're opening up a whole nother can of worms here, but I can tell you that we are trying to disrupt what we're doing here by dealing with a lot of those things. And I can tell you that a lot of our contracts are saying you can't go to our people that we're contracting with, or we're going to cancel the contracts. So we got to be really careful about how we do this.
No, I get you got to be really careful, but you can have a conversation, right?
Absolutely.
With folks, and it's going to be tough on them. I know it's easy for them to cancel contracts.
Yeah.
But
maybe that's the best thing that ever happened.
Yeah, in some cases, yeah. But because they're no longer under reimbursing you.
Yeah.
But at the same time, you got to do the right thing.
Sure. Absolutely.
Because that there are people who can't afford their medications and they can't get them. You see them at the counter every day. How often has it happened where they're getting ripped off, they can't afford their co-insurance, and you haven't done anything.
Yeah. Yeah. Unfortunately.
And then when that happens, if you track all that stuff, and then if they come after you, you send it to the insurance commissioner, not about the PBM, but about the insurance company that owns the PBM, or the PBM that owns the insurance company.
Right. Absolutely. Well, we're going to have to wind it down. Thank you, Mark. I appreciate you being on. Daniel, do you want to go ahead and close this out?
It's been a fantastic conversation. And just to our Pharmacy Frontier listeners, you have it firsthand right here from Mark Cuban, who says you can quote him as you go out and market your business, not just to improve the care of your community and decrease overall costs, but to get communication to those payers so that we can be working together to all become disruptors in this industry that needs a lot of work. So thank you,
And then
Mark, for being
one
with us.
last point, check out Team Cuban Card. If you don't, if you're not a member, if you're not an affiliate of our 17,000 network, please join. We'd love to add you.
Team Cuban Card. Very good. Well, thank you for being with us, and thank you for.
Thanks, guys. I really enjoyed it. Take care.
Have a good day.
You too.
Thank you for joining us today for the Pharmacy Frontiers podcast. And please share this episode with your friends and colleagues and seek out the previous Pharmacy Frontiers podcasts on your favorite podcast channel.